Okay, blood flow coming out of the heart. See if I can do this and not get my fingers in the way. Leaves by way of this conus arteriosus here and splits in the left and right truncus arteriosus here and here. Each of those three in turn split into three arches, and that's what we're going to expose over here. And let's see if hopefully my fingers are not in the way. They include the carotid arch here, most anterior, systemic arch right in the middle, and then pulmocutaneous arch, which is most posterior. The pulmocutaneous arch has two branches. One, the pulmonary artery here, which leads to a lung. Oops, lung's a little bit further down here, sorry. And then one that's very skinny and almost broken here, and that is the cutaneous artery leading the skin. That generally supplies oxygen poor blood to, again, the skin or the pulmonary artery to the lungs. Now back to carotid arch, which is right here. It splits into two vessels, one of them going out to the side laterally and has this swollen carotid body or gland on it. That is the internal carotid artery. The external carotid artery is broken on this one, and it would be going up this way. So it's not present on this one. And there's often a thyroid gland there. It's not present on the specimen either. Okay, so the last of those three arches is again that systemic arch, which is this one right here, continuing on around this way. And a couple of branches that it has includes this one, which is subclavian artery changing into brachial artery as it gets into the forelimb. Occipital vertebral artery is not visible in this specimen. It hasn't been cleaned out enough to see it. It would be down right in this area, but it's not been cleaned out enough to see it. Okay. Now to the posterior section. These are the two systemic arches, and where they join together, they form a dorsal aorta down the length of the back. Branches off the dorsal aorta include first this big one, celiaco-mesenteric artery. It splits into a more anterior celiac artery, which is this one here, celiac artery, and a more posterior cranial mesenteric or anterior mesenteric artery right here, which further subdivides into one that feeds the spleen, the splenic artery, and then a branch that's going to go down to the intestine, small intestine. That is this one, intestinal artery. You can see it going to the intestine here. Okay, I'm going to flip this backwards again. And to get more self-oriented again, this is the dorsal aorta here. This broken organ is kidney. And that means these arteries leading to the kidney are urogenital arteries. Well, right at the same level, going to the back, muscles of the back, these are lumbar arteries. Okay, and then where do we go from here? And now I need to find another frog. Well, I can show you here. This is where it splits. I can see it splitting into the two common iliac arteries here. And now I need to find another frog.